Hello, I'm Mabel Jong, and you're watching the World Healthcare Congress Interview Zone. Right now I have with me Dr. Stephen Shapiro, who is Chief Medical Officer at the University of Pittsburgh Medical Center. Good morning. How are you?
Oh, thanks, Mabel. Pleasure to be here.
Dr. Shapiro, you've just gotten off a panel that really focused its conversation on evidence-based healthcare. Really evidence of value is what we're looking for. So there is a lot of data that is coming in. How are you interpreting that data?
I mean, the good news is now that we've gone from the paper to the electronic record, we have all this information, but not a lot of intelligence. So we're investing a lot in analytics so that we can really try and take all of this great wealth of information and really try to develop new models of care that improve outcomes that are most cost effective based on this wealth of data that we're getting.
At UPMC, you are in the unique position of providing end-to-end care. That is, you finance the care as well as deliver the care. So what sort of things have changed in light of changes in the sector overall versus what has already been in place that you'll continue to do?
Well, as a large payer provider, we've always had a collegial relationship with the health plan. I mean, as the health system, we're really good at delivering acute care. The problem with American medicine is it's fragmented. The payers are really good at coordinating that care. So working together, we think that we've made progress. Although with the really radical changes that we're seeing in healthcare now, we know we have to make this transformation from volume to value full speed ahead and really integrate even further.
And really the person who's driving that is the consumer. There's so much more control in the patient's hands now.
Yeah, the good news for the patient is that they can dictate how they want their health care to be delivered to them. The bad news is they're paying for more of it, and that's really, I think, the subtle part of healthcare reform that has changed everything. All of a sudden, the consumer is now responsible for paying for this, and this then really is what's driving our need to really make this transformation for our patients' sake, to lower our cost of care, make it most effective.
So what is the responsibility of UPMC in terms of educating the patient? I mean, you really have to go out there and educate a patient on what they're paying for, what's needed, what's not needed. Is that so?
We have to educate them on healthy behaviors to begin with, but also the cost is important. And a dirty little secret is, as physicians, we really don't know what things cost. Even as a health system, we talk about charges. We've done a cost management system with our finance, so we really are getting a handle of our costs so that we can really let the patient know, and we're publishing it so they can find out what tests cost and where, and our providers get this information as well.
As a physician, there is also a lot of discussion that more doctors need to come to the table to really lead the change. And it seems to make sense since you're on the front lines with talking with patients. Are we seeing more doctors come willingly to the table to lead in this change?
I am seeing it. I mean, personally, I was a physician scientist. I like taking care of patients and doing scientific discovery. But as healthcare is undergoing this revolution, it's exciting, it's important, and many people like myself are getting much more involved in the overall leadership, because we do think we need to change the culture and we need to start with the physicians.
So what does the day-to-day activity look like then? I mean, in terms of the way you do things when you're talking with patients and when you're talking with your team?
It's changed a lot. I think a lot of my time now is working with the health plan and the hospital and the physicians to try and really make this transformation. But still see patients, and so I can get a really good feel for that, and still have a small laboratory to make discoveries, because we really do think that advances in science and technology are going to really enable us to personalize care as well.
We're so glad to have you on the panel at the Congress. So what is the message you want to leave with attendees?
I think it's a tumultuous time in healthcare. The topic we were discussing was evidence-based medicine, and unfortunately only about a quarter of what we do has strong evidence, but with the real advances in science and technology, that's going to improve dramatically. So as we undergo a rough time really reconfiguring healthcare, then ultimately the care that we're going to be able to deliver our patients is going to be phenomenal, and we're going to be able to do things we never dreamed of before, which would make the whole medical system much more rewarding in the future. So I'm very optimistic.
Great, and we're going to leave it there. Thank you so much. And I'm Mabel Jong. Thanks for watching.